everyone, good evening. I'm Melissa Idris. Thank you so much for watching Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Now, it's been about 5 years since 800,000 Rohingya refugees crossed the border into Bangladesh from Myanmar to join those who had already fled recurrent cycles of violence against them by the Myanmar military. Now, today, over 920,000 people live in Bangladesh's Cox's Bazar refugee camps. Just how much have the living conditions of these refugees changed in these past 5 years? And how can the international community step up to do more to address what is becoming a protracted refugee crisis? Today on the show, we have Dr. Paul McMahon. He is head of projects for Médecins Sans Frontières in Southeast East Asia and the Pacific. Médecins Sans Frontières is also known as Doctors Without Borders. They provide medical assistance to people affected by conflict, epidemics, disasters, or exclusion from healthcare. Now, Paul has recently returned from the largest refugee camp in Cox's Bazar. It is known as the Mega Camp. It is a collection of 26 camps and is the world's largest refugee settlement. Paul, thank you so much for joining us on the show today. We appreciate your time. Now, can I begin our conversation tonight by asking you what life was like in the camps? I mean, what did you learn from speaking to refugees about their lived experiences?
Thank you, Melissa. Thank you so much for taking the time to put the spotlight on this situation. I think the first thing that is striking when you talk to refugees is it's just a sense of despair because they don't see a solution. They don't want to be in Bangladesh. They want to go home. As we all know, we don't see safe conditions for a return. And so they live day by day in what is essentially a camp that was set up to be a temporary camp. With structures that are of a temporary nature. They see their lives getting harder and harder, to be honest, and they struggle most, I think, with the fact that they have really no agency. They have no choice in what happens to them next. They're almost entirely dependent on the assistance that they receive from Bangladesh and from the international community, and so I think it's this sense of directionless, losing hope, feeling despair, and then, of course, on top of that, having to deal with the daily trials of trying to cope and find what they need to secure the welfare of their families.
I think the sense of despair is important. I'm hoping we can address that throughout our conversation, Paul, but I do want to ask you from a medical perspective, from a health perspective, what is Médecins Sans Frontières most concerned about the health conditions at Cox's Bazar camps?
Yeah, so our biggest concern right now is trying to maintain, some reasonable level of health and welfare within a camp. When you have, as you mentioned now, actually the numbers are more than 1 million people living in what are incredibly confined and cramped conditions, separated, as you said, across a number of camps within a mega camp setting. The biggest trial and challenge to this, of course, is the living conditions themselves. As I said, things are of a temporary nature. Housing has degraded. You imagine 5 years of dealing with rains and monsoons. So trying to maintain an adequate level of hygiene, trying to secure, reasonable access to water, trying to manage sanitation, all of these things impact the environment. And as a result, we see in our clinics a sharp increase currently in terms of some spread of infectious diseases. Particularly, we see skin infections, and most concerning right now is a real spike in the incidence of scabies, which is running across different parts of the camp. And we're really concerned about how to control that and how to treat that. And we're also seeing a really increasing number of patients coming to us with chronic diseases. So these are less the kind of emergency-related problems and more related to kind of chronic diseases. So we're talking about diabetes, hypertension, asthma. Some of these things need, can be treated, but access to facilities that can treat those problems are very few. And some of these problems really need referring, and they need referring outside of the camp setting. And that's very, very difficult to do, as of course the refugees are are confined. They're meant to stay within the camp and not actually move inside and outside of this camp setting. So we
So,
really see. Sorry.
sorry to interrupt. I just wanted to follow up. So, even for medical procedures, medical follow-ups, they're not allowed to leave the camp.
There are pathways for referral, but they tend to function when you're referring an emergency. And an emergency is something that very often is quite visible. No? If you have somebody with a trauma, or you have somebody with a complicated pregnancy, it's pretty obvious that there's a medical emergency. But there are many types of critical and urgent care where the signs are not immediately obvious. And you imagine you have to negotiate your way through military checkpoints in order to secure access outside. You may or may not have some kind of referral papers, and they may or may not anyway be accepted. It is very, very difficult for people to move freely. And so, yeah, this unfortunately places a real challenge. And then within, of course, the camp setting, there are those that would try and control the movement of people, extort people. And so, yeah, it's a real problem that the more urgently you need to get out of the camp, perhaps the more you might pay to be able to find a pathway. So it is a real challenge for people to move both within the camp, between camps, where maybe services are available in one part of the camp but not in others, and to move outside of the camp itself.
And what about supplies? I'm thinking about medicines and other, needs for health and welfare. Are the supplies? Is aid coming through? Is there? I can imagine nothing can be sufficient or at a level where you would consider, sufficient. But is there enough? Is it coming through? Or are there blockages and challenges in receiving aid?
Yeah, I mean, it's definitely not a simple black and white answer. Despite the huge effort and support the Bangladesh government has put into this year on year, plus the investments, of course, of the international community, what we see is that the delivery of support is not distributed evenly across the camp setting. The camp works on this logic where each of the camps should have a kind of package of services, so you don't need to move because you can access services in your area. But what we find is, of course, that the quality and availability of those services varies depending on where you are within the camp. So indeed, some parts of the camp you may not have access at all to the kinds of clinics with the medicines and treatment that you might need. And you might find at the camp, that those clinics are in fact not open, that the hours are very short. We are seeing many, many patients referred to us now from widely across the camp because they simply can't access the services they ought to be able to access locally. So this distribution and the unevenness of the quality and availability of services is indeed one of the problems.
What about COVID, the spread of COVID? Has vaccination been completed across the camps? Are you seeing cases of COVID spread in the refugee camps?
I mean, COVID was for sure a problem, broadly across Bangladesh, but I think the Bangladeshi government adopted very early on a very good policy, which was to say, for the safety of everyone, we need to ensure vaccination coverage is available for everyone, be they, host communities, refugees, or whatsoever. So that indeed was, I think, a very smart move from a public health perspective, and it was a big contributor to helping limit the impact that COVID had. Of course, we did see COVID was a problem. Of course, that did affect people both in and outside of the camp setting. But it was through our own investments, the investments of others in the health sector, our counterparts in the Bangladesh health authorities, we were able to manage the impact of that. Right now, of course, we do see in Bangladesh there's another spike of COVID, so things are starting to take off again, as they are in many other countries. So it remains to be seen what will happen with this new wave.
Are you seeing an impact of this protracted crisis on the children who have been perhaps born in the camps and grown up in the camps with perhaps inadequate food, inadequate nutrition? What are you seeing among the children who live in these camps?
I think the most striking thing is you see children 5 years old who've never known anything else. They have grown up in a camp setting. They they lack, the security of a community, that a family and a community would normally provide. The environment is much more, that they are much more vulnerable within that environment. Parents fear what will happen to their children on a daily basis. Access to education is certainly something that I know is currently a priority that various, both Bangladesh and international community are trying to improve and address. And certainly, children are one of the most vulnerable when it comes to the spread of infectious disease. And we certainly see across our clinics a large number of children. I think one of the things to say is that one of the biggest impacts we see, of course, is on their mental health. Because they don't live a normal life. They don't have the freedom that other children have. They don't feel safe a lot of the time. They do witness things that children should never witness. And also there's an impact in the way that their family and community network is constantly under pressure. And so, yeah, we see children exhibiting a lot of mental health conditions, from insomnia, the inability to sleep, bedwetting, fear and anxiety, inability to concentrate, and all of these things are manifested from just living at such a high level of vulnerability, and like I say, for many, not actually knowing anything else.
Can I ask you, Paul, about if there is a gender dimension also to the impact of living under these conditions? If you think about women and as you mentioned, the directionless, the hopelessness and anger might translate into more violence, particularly gender-based violence. Can you comment a little bit about the gendered impact of these conditions?
Yeah, I mean, we see in settings all over the world where, where people have lost everything that they have and they end up in desperate conditions. We see that there's an impact within the family nucleus, and you often see this kind of domestic violence, and then of course also people live in harsh conditions. Resources are scarce, there's competition for those resources, and so it becomes an unsafe environment. It can become an unsafe environment, particularly for women. So we do in our clinics try and focus specifically on these problems. We try and provide tailored medical services to women, particularly when they come seeking our care because of gender-based violence. That certainly takes place. I would stress, not only in the camp setting, we also receive patients from outside the camp setting in the host communities. So this is not exclusive. We suffer from this in all of our societies, but it's definitely something that's prominent in these kinds of camp settings. It's something we try and tailor very specialized medical services, both in terms of treatment of clinical disorders, but also mental health disorders from that.
Okay. Paul, we're going to take a quick break, but let's come back and continue this conversation, particularly the role of the international community in addressing this crisis. We'll be right back here on Consider This. Stay tuned. Hi, thanks so much for staying with us on Consider This. I'm Melissa Idris. Let's continue this conversation with Dr. Paul McMahon. He's Head of Projects for Médecins Sans Frontières Southeast, East Asia and the Pacific. Paul and his colleagues were recently at the largest refugee camp in Cox's Bazar in Bangladesh. It is the world's largest refugee settlement, where currently more than 1 million refugees live, many of whom are Rohingya who have fled the violence in Myanmar. Paul, as the conditions in the camp continue to deteriorate, there's concern that many refugees are becoming more and more desperate, more and more hopeless, making them choose choices that are riskier. And some of them have chosen to make the perilous journey on human trafficking boats to countries like Malaysia. On this show, we've covered extensively the vulnerabilities they face when they get here, or even if they make it to Malaysian shores. But there are other refugees, Paul, we understand, are choosing to relocate to the remote island of Bazar. And I'm just wondering what you can tell us about some of the concerns that the international community might have over relocations to Bazar.
Yeah, I mean, we ourselves have requested the opportunity to visit Bazar so that we can assess for ourselves the provision of services there and assess if there's a role that we can play in contributing to providing health services in Bazar. So far, we're still waiting for an agreement to be able to do that. So it's not an island setting that we've actually got our own direct experience of. So what I can say is quite limited. I mean, the obvious concerns would be, that any location that's going to be purpose-built for managing, an overflow of refugees or internally displaced people, it really needs to provide, adequate protection. It needs to provide adequate access to all of the range of services. Ideally, unlike the setting that the refugees are currently in, it would ideally also need to provide more space, more opportunity for people to actually fend for themselves. So these are kinds of considerations that were not possible when the influx of refugees arrived from Myanmar. The camp grew up because the people were there. Obviously, with Bazar, if you're making a purpose-built space, you would hope that the conditions could be far better, more space, better thought out, much more permanency in the way structures and shelters are constructed, and much more adequate provision of water, sanitation, availability for schooling, availability ideally to work, etc., etc. As I stress, we are still waiting to get permission to go, so we haven't been able to independently assess that for ourselves.
Well, the trip was also meant to engage with government authorities and other stakeholders in Dhaka. Did you manage to meet with the Bangladeshi government? How was the response?
Yeah, no, I think we had a very, very strong welcome. I mean, I think MSF is quite well respected in Bangladesh. We've worked there actually on and off since '72, so it's almost since the time of independence of Bangladesh as a nation, and certainly much more intensively in the last 30 years. So, we do enjoy good relationships with our counterparts, particularly our medical counterparts. And I think the key on everyone's mind is the concern about this huge crisis, this huge burden of refugees being hosted currently in Bangladesh. What will be a durable and more longer-term solution? And then the number one concern, I think, is that with other international crises that are unfolding, none the least Ukraine, also Afghanistan and other emergencies, how do we keep the situation that we're currently trying to manage in Bangladesh a top priority among the other emerging priorities? There's a real fear and concern that the international community will be distracted and resources will end up going elsewhere. We need to emphasize that this situation in Bangladesh is not resolved. And looking politically at the situation between Myanmar and its neighbors, it looks unlikely that it will be resolved soon. So how can we divert another impending emergency by ensuring that we don't lose sight of Bangladesh as a priority in the coming years?
Are you already seeing that, Paul? Are you seeing perhaps attention, resources, coverage being directed to other crises, particularly the Ukraine crisis?
Yeah, I mean, there's a fear. Certainly, the UN coordinated funding mechanism is still nowhere near the level of pledges that we would like to see, or the international community would like to see. I would stress we're outside of that mechanism. We independently funded our own programs, are committed for the coming years, but certainly broadly across the community, there are big questions about the availability of funding going forward. And as a result of that, of course, there is a discussion about how to rationalize the provision of services currently, which is essentially saying 5 years on, we should be able to make the provision of services more efficient, more effective across the camp, do more with less. That's essentially the way forward. And I think some tough choices are clearly going to have to be made to do that and do that well. So I think this is top of mind for both the Bangladeshi authorities, but also the international community and the UN agencies that are responsible for coordinating, this gradual change. But as I would stress, top of mind for us, Doctors Without Borders, is just as I said, we're already facing problems in the camp where we're being overwhelmed with patients who who are not finding the provision of services available to them necessarily in the area where they should be. So on top of that, the concern for us is if we see a further reduction in services, how are these reductions going to be made, and can we ensure that the essential services remain in place, and that the funding will be there to back that up?
Are you seeing, so because Doctors Without Borders operates in so many other countries and conflict zones and where medical attention is needed, my understanding is that it's for a temporary disaster relief or a conflict. This has been a long time. It's been a protracted crisis, and I think the repercussions have kind of snowballed until today. Paul, what do you want people watching today to understand about what was meant to be kind of a temporary camp has now been, 5 years on, has grown to become the largest? What would you like people to understand in terms of the solutions for, long-term solutions? Is the thinking that they will languish in these camps until until the issues, the political issues, the violence in Myanmar is addressed?
Yeah, I think for the general population, certainly for our audience in Malaysia, the number one thing I would want people to try and understand is that the Rohingya in all of this, that they are blameless. They have suffered persecution for decades, and this exodus was the result of fleeing from an incredibly violent campaign of terror against them. So their arrival in Bangladesh was forced. It was certainly not voluntary, and everybody I spoke to, every single Rohingya family wants to go back. It's not that they're economic migrants, or they're illegals, or they want to start a new life in Bangladesh or elsewhere. No, they want to go back to Myanmar, and they, nobody thinks that the safe conditions for return are there yet. So that would be the first thing. And then you're absolutely right. The second thing would be more broadly to everybody involved in the response. We have to be prepared for this response to continue to be protracted. 5 years is already a long time, and yes, this population will continue inevitably to depend off the goodwill of the Bangladeshi government and the Bangladeshi community and the international community together. They have no choice in that matter. And so we're going to have to do everything we can to not only ensure that the humanitarian support that they need on a daily basis is not reduced to the point where they suffer even more, but that also, as much as we can, we start to consider that this environment can't be sustained with just temporary solutions. We have to accept that there's some level of permanency, and we have to see where we can go step by step to then try and improve conditions within the camps, knowing that this is not going to be resolved in the next year or 2 years, or probably longer. At least it doesn't seem very likely to anybody I spoke to currently that will be the case.
Have you seen anything like that in other refugee camps, that perhaps there is a plan or a move to create more permanency in terms of the facilities, in terms of healthcare, and to take care of the welfare of the refugees? Is there anywhere else in the world that has done this, or has the political will and the international will to see it done?
I think we've seen lots of examples where host communities have opened their doors to refugee populations, and it's understandable that after a period when these conflicts are protracted and refugees can't return, that the burden on the host community and on the host government, it becomes very, very, very hard. It's completely understandable that this takes a toll on the country and on the host community. I mean, their services are not designed to absorb a million refugees. Communities are never designed with this in mind. So that's of course understandable. But what we do normally see is a gradual change in terms of the living conditions. We do see more permanency. We see a change in the types of structures. We see more ability for people to access to more mobility, to move around, to in one way or another develop some kind of livelihood, so that they can in some way sustain themselves, and they're not entirely dependent on the assistance of others. And these are some of the challenges for the response moving forward. And I know that there's an awful lot of people committed to try and find the right way forward. But certainly this is one of the problems that we see manifested in our patients seeking care within our clinics at the moment.
All right. Thank you so much, Paul, for speaking with us tonight. I appreciate your time. That was Dr. Paul McMahon from Médecins Sans Frontières, or Doctors Without Borders. And that wraps up this episode of Consider This. I'm Melissa Idris, signing off for this evening. Thank you so much for watching, and good night.